everyone. It's Nicole Walker. I'm one of the physician assistants at Norterra Family Medicine. I'm bringing you your Wellness Wednesday for October, so thanks for joining me. And I'm just excited to talk with you a little bit. So it is October, so that means it's Breast Cancer Awareness Month. So I thought, what better month to review and explain some of the recommendations for breast cancer screening, and not only just review what those recommendations are, but also explain what does it mean when you get something that reads as abnormal, or there's recommendations that say, hey, you need to get additional mammogram views, or you need to get an ultrasound, or I know it can be very worrisome when you get that call back for additional imaging, and I know it's very stressful. People get very nervous about that. So I just want to kind of discuss that, what those things mean. I don't want you to be too stressed about it, so I just want to make sure you understand, hey, this is why we get those callbacks, and this is why we get those exams done. So let's get into that. So to start with, recommendations. So for breast cancer screening, in general, women should start doing mammograms from age 40 until they're about 75. And that's for everybody in the general public. Now, studies have shown that regular breast cancer screening, starting at the age of 40, reduces breast cancer mortality in the average risk for women. So that is why we recommend the screening, and that's why we have that. Now, some women, and some men actually, have a higher or an elevated risk for breast cancer. So those might be cases where an individual may be recommended to start screening earlier, at a younger age, or maybe even continue screening beyond the age of 75. Those people typically maybe have a strong family history of breast cancer. They might have some type of genetic mutation that's been checked, so they know they have that. Maybe you've had some type of radiation to the chest area. Those are some instances that you might have an elevated risk for breast cancer. So screening guidelines come from different medical societies. So I think it's important to know we're not just making this up. There's guidelines that we're given, but there's a lot of different societies that give those recommendations. So some of those do include the U.S. Preventive Task Services, the American College of Obstetrics and Gynecologists. There's the American College of Radiology, the American Cancer Society, and there's more. That's just a few of them that give us these guidelines. Now, the tricky part for us as providers is that they don't all give the exact same advice. They're all pretty similar, but they're not all exactly the same. But in general, an average woman should consider having a screening mammogram, again, starting at age 40, annually to biannually. So that's every 1 to 2 years. So that's the general population of all women. All right, so now let's get into some abnormal things. So abnormal mammogram results do come back very often. We see that a lot. They'll usually just say, hey, we want some more imaging to look at a specific area. So this can be due to like a shadow that they see on the image that wasn't there the year before. There could be density that's just really hard to determine. Is this normal? Is it not? There can be some asymmetry between one breast and the other, and they want to look closer and see why are they asymmetric? Is it normal? So when a result like this comes to one of us providers, we will contact you and let you know, hey, there is just something new on the image. Most likely it will be determined to be normal, but we don't know that. So we need to get these extra views. It could be additional mammogram views that we call diagnostic views. It could include an ultrasound also. So I do try to make these calls myself. Again, I want to make sure you understand it's very important to get the exam done, but I want to have that conversation because I don't want you to overstress over it also. Like, just get it done and let's just make sure everything's good is the way I look at it. So one other piece of information we get on most mammogram reports, comments about the density of the breast tissue. So I know I have a lot of patients ask about that because a lot of them say dense breast, and what does that mean? So dense breast tissue, one, it's not something that you can palpate and tell, oh, I have dense breast tissue. You can't tell. It's a radiographic finding when they're doing your images. So having the mammographically dense breast is a very normal thing. It's not abnormal, and actually I think about 50% of the population has what they consider dense breast tissue. So having the dense breast tissue, though, it can obscure and make it hard to find abnormalities, and so that's why it can be concerning to the radiologist. So dense breast tissue is put into categories. So you have A through D. Now category C and D is progressively more and more dense. So again, about half the women in the US have a category C or D density. So it is very common and very normal. Now for patients with these dense findings, there may be recommendations for just extra stuff when you're just doing your general screening. So if you're getting your mammogram annually, we might say, hey, the radiologist has recommended you consider having a bilateral ultrasound on both breasts also at the same time, just to look at it in different ways and get more information, and to help avoid missing a look at areas where it's dense if they don't want to miss anything. So one other situation to be aware of is radiologists may give us a comment or a finding of a person's lifetime risk for developing breast cancer. So there's risk calculators out there that they use for this. For patients with a lifetime risk of breast cancer above 20 to 25%, there's a recommendation typically to consider having an MRI of your breast tissue every year also. And this is usually rotated between your mammograms. So every 6 months you might get an exam. It might be your mammogram, 6 months later the MRI, 6 months later the mammogram again, and rotating like this. So it's, again, an added screening tool. The risk assessment to determine this and where your lifetime risk is, it's based on family history, any known gene mutations, again, history of radiation therapy to the chest area, maybe the breast density, and other factors. They all play a role in that. So, okay. That seems like a lot of information to give in this short little clip, but I think it's really good for you to hear it and try to understand it. So if you have any questions, feel free to reach out to us. If you feel you're due or needing any screening, definitely let us know. So please be aware that we, as your providers, we use your annual wellness exam in part as a time to review and discuss this type of screening. We're looking to see if you've done it. The recommendations, are you due for it? Do we need to get it ordered? When is it due? That's just a piece of what we're doing when you're here for your annual exam. So, all right, well, that's what I have for you this October. I hope you guys have a great rest of your day, and we'll see you soon. Bye.